Years ago, the overwhelming majority of plastic surgery patients were women, but these days more and more men are getting cosmetic work done.
And one of our very own reporters, Ted Garcia, recently took a camera crew into surgery with them. He joins us now, tells us all about his experience.
Here he is, the new Ted.
You know how bizarre it is just to watch your own surgery? That's kind of the scary thing.
I don't want to.
Logging the tape and looking at all the blood and stuff. You know, but a lot of guys don't realize plastic surgery is an option for them. For years, I'd been thinking about getting some work done just to improve my appearance. Finally found the right doctor, and what you're about to see is kind of a condensed version of the entire process. This is a morning show, so we've cut out most of the graphic stuff.
Oh, good.
Here's a look at what I went through in just 3 weeks ago. It all starts with a consultation. So my question is, I have kind of a baby face, kind of a round face. What could be done to sculpt it a little?
Yeah, you have a little bit of a disproportion. I mean, you have a very pleasant, very good-looking face, but there's a little bit more heaviness in your face than there is in your body.
Dr. Brent Mulligan is a Beverly Hills plastic surgeon. Over the last few years, he's seen more and more men go under the knife.
I'd say when I started in practice, it was maybe 5% males, but I think we're up to 15 now. 15% males. Okay, now we're removing the fat.
The #1 procedure for men these days is liposuction, which I had done under my chin.
Yeah, a lot of fat's coming out here, so that's great. For the area under the chin, this is going to make a nice difference for him.
Another popular procedure for men, the chin implant. They come in different sizes. This one is a large.
This is just the right amount for his face. Anything more just looks kind of cartoonish. So we don't want to go with that little bit larger size. So it fits in perfectly, just popped right in place. And I think this is going to be the size that he's going to be happy with.
And finally, I had what's called a buccal fat extraction. Everyone has walnut-sized pockets of fat in their cheeks, which can be removed to give a more chiseled look.
Wow, this is a very large piece of tissue here that he does not need.
Fast forward 4 days. It's back to the office. Dr. Mulligan takes off the bandages, and here are the results. Before and after. A little enhancement that'll last me for a lifetime.
Donny Osmond. Look like Donny Osmond.
More like Donny Osmond than before.
So you're still somewhat swollen right now.
Yeah, still under here. And you know what we got to tell people? Plastic surgery is not for everybody. You know, there are critics out there who are probably going to say it's all about vanity and all that stuff, but I think there's a lot more to it than that. It's about what's doing what's right for you, making you feel better, you know, inside and out. And also, we're going to have a 2-part series on male plastic surgery. We're going to show more of this tonight on News at 10.
Oh, more?
Okay.
More, yeah.
Oh, I'm glad you cut out the graphic parts.
Tell me about that. Now, you said something at the beginning about why you did it, but I mean, all your life you wanted to, all your adult life, you weren't happy with the way you looked, and that's why you did it?
I used to weigh like 90 pounds in college, and then I started doing a morning show in San Antonio and gained a lot of weight, and it all came right here, under the chin and the cheeks, and then it wouldn't go away. So for a couple of years I've been wanting to do this, and the doctor, Dr. Mulligan, said, hey, you know, we can do this, this, and this. He showed me before and after pictures, and it turned out that it came out exactly like I wanted. But you were saying, still a little swollen here, it's going to be even more pronounced.
So you'll see more of your jawline.
And it wasn't painful.
And how much does it cost?
A couple of grand per procedure, but you can finance. A lot of people think that you have to take the $10,000 cash in and get plastic surgery. You can finance it through the doctor or put it on a credit card, pay it off, whatever. But more and more guys are doing it, and I'm really happy I did it.
You're very pleased, huh?
I am. I'm very pleased.
Well, we thought you were handsome before, but even
Everybody
more so
says
now.
that.
Yeah, no, we thought you were perfect before. Yeah.
Oh, they all say that.
You should have done it years ago.
Yeah, thanks, Mark.
You know what? For more information, just go to our website and watch
Dr.
News at
Brent's
10
website.
tonight. Watch News
Dr.
at 10
Brent has a
tonight.
website?
Yeah, he does.
drbrent.com.
He does. He'll answer questions.
All right.
drbrent.com.
We're
You look
still,
marvelous.
Thank you.
And you're as sweet as ever. That didn't change.
Yeah, that's good.
7:57. We still love you. Coming up next.